So we're very pleased that you've joined us tonight. This is the League of Women Voters, Arlington Heights, Buffalo Grove, etc. Environmental Committee webinar. We have been doing a series of these webinars over the past couple years. Last year, we did a webinar on how to electrify your life. We had experts from Illinois on EVs, on thermal, on solar, on how to electrify your house. So tonight we're in for a big treat. We have two esteemed medical doctors / activists who will be talking about their work. And the title is A Look at Climate Through the Reproductive Justice Lens, which is kind of a unique niche presentation that I myself have never heard of. And I've been in the environmental movement and field for 30 years. So you're in for quite a treat. First, I'm going to turn it over to our League of Women Voter President, Shannon Silverman. Shannon Race Silverman serves as the co-president of the League of Women Voters of Arlington Heights, Mount Prospect, Buffalo Grove, Wheeling, Prospect Heights, and Elk Grove Village. Shannon is a problem solver, organizer by nature, and an advocate. She also serves as a trustee on the District 214 Educational Foundation. She was formerly a partner with the law firm of Meltzer, Purtell, and Stale as a business and corporate lawyer. So she brings expert legal knowledge and practical advocacy skills to her work. We've been extremely lucky to have Shannon as our co-president. She is a tireless advocate for all things, especially climate. So I'm going to turn it over to Shannon now.
Hello, everybody. Thank you so much for joining us tonight. I like to say that there goes my dog. I was keeping my fingers crossed. There's one in every crowd, right? I'm so sorry. My home situation is what it is tonight. So we like to say that our mission is to empower voters and defend democracy. And one of the reasons I am so thrilled by this program tonight is that it does do that. It allows people to get the information on a like Liz mentioned, a niche area of climate and reproductive justice, and that at that intersection, and how it relates to taking action as a voter. And that's where we come in. That is right at the heart of League of Women Voters. So thank you all for coming tonight. And with that, I can't wait to hear the program myself. Thank you, Dr. Sullivan and Dr. Gomez.
Thank you, Shannon. Thank you. So without further ado, I'm going to introduce our two fearless leaders and speakers tonight. First, Dr. Regina de Leon Gomez is a board-certified OBGYN and is an assistant professor and course director for the Chicago Medical School in North Chicago. Dr. Gomez received the Excellence in Educational Innovation Award in 2023. She was instrumental in incorporating the effects of climate on health for the curriculum, which is, again, a very innovative thing to do. That's my editorializing. Dr. Gomez's clinical work is focused on inner city and indigenous people, Medicaid recipients, and those who do not have health care. She was recognized as a Harry S. Truman Scholar in 1989 for her commitment to serving the public. She went on to complete her medical degree at Northwestern University and residency in Washington, D.C. She is also a lieutenant commander in the U.S. Public Health Service for the Indian Health Service. She was awarded a citation for exemplary performance of duty in that role. The next 2 decades, Dr. Gomez worked in the bedside and acute care at Northwest Community Hospital, serving as the OB Hospitalist Program Medical Director. She worked specifically on perinatal safety and quality initiative, addressing the most pressing issues affecting pregnant people. As you can tell, she is really very much supportive of the needs and awareness of the vulnerable populations of the people who are marginalized and disenfranchised. Dr. Gomez became a climate activist after learning the, quote, inconvenient truth at the 2017 Climate Reality Leadership Core Training. If anyone knows about that, that's the training that Al Gore started. Leveraging her experiences as an OBGYN, she began grassroots work in her faith community, the League of Women Voters, and the Society of OBGYN Hospitalists. Dr. Gomez was a past recipient of the League of Women Voters Pat Lidnar Award. She was also a founding member, along with Dr. Sullivan, of the Illinois Clinicians for Climate Action. She welcomes anyone who wishes to join in climate advocacy efforts so that we can realize a better future for ourselves and our children. So with that, I will turn it over to Dr. Gomez. I will introduce Dr. Sullivan before she talks. Over to you, Regina.
Thank you so much. I think we're just going to switch the slides. So I just want to start off by saying thank you to the League of Women Voters for providing this opportunity. I'm just super excited, to talk about this, and this is how we're going to proceed. So the title of this talk is a bit lengthy, but it's Meeting the Challenge of Civic Engagement on a Look at Climate Through a Reproductive Justice Lens. So this is how we'll proceed through the talk today. I'm going to introduce to you kind of my civic engagement hypothesis, and then we will move on to some OBGYN issues, and then close with Dr. Sullivan on the pediatric issues. So slide. One back, yes. So there is an operating premise for this talk, and this is my disclosure statement. You will see on a number of these slides the word abortion, and I want to address that head on and alleviate any discomfort or distress that may or may not create for some of our audience members. And I want to assure people that this is not a pro-choice, nor is it a pro-abortion presentation. What this is a pro-health, a pro-people, a pro-child, a pro-family, and a pro-community presentation. Now, I am operating on a premise of that health is a right, and there could be some dissension on that, but I'm just stating that up front. And I want to assure the entire group that there should be a space for everyone, I think, in this discussion. My disclosure is the ideas here are my own. They don't represent any organization. They don't represent my employer. And I have no further disclosures. And then the last thing I'm going to say is when we start talking about some clinical cases, I realized from kind of a care standpoint, trauma-based care, that some stories may be triggering for some of you. So you can feel free to, get off the call, turn off your camera or mute me if that's what you need to do. So again, Dr. Sullivan and I are just very grateful, to have an opportunity to introduce concepts that have been vital to our work as physician climate advocates. And next slide. Yes, so the primary objective, one forward, there we go. So after completion of the presentation, you, the learner, will describe how reproductive justice can be a powerful platform for our climate advocacy work because of people's track record of voting for reproductive rights. Language matters because the terms we use can better describe kind of what we mean, or maybe even better describe the mutuality and solidarity in our shared concerns and issues. Next slide. We do have some secondary objectives because I think it's only fair to give you the answers to the teaser that we had on our flyer. And that was, do you know how heat and pollution can affect pregnant people? So after the completion of this presentation, the learner will describe how the changed climate and environmental degradation is affecting female or women's health, and also hopefully recognize stories of how heat, pollution, and extreme weather impact pregnant people. I did want to say that slides 17 and 18, they are the Venn diagram slides. Those are my original work, and I've made sure to include references and on each of the slides for any of you who wish to refer to it. Okay, so through the looking glass, these are some interesting historic illustrations. Alice in Wonderland saw a lot of strange things. Sometimes we can better appreciate things when we look through a different lens. And this is a lens that can embody the intersectionality and the synergy that we have in our work. It's a lens that allows us to think on a systems-based level. So next slide. So where does this motivation to vote surface? So after Roe v. Wade, people proved that they will vote for reproductive rights. On the bottom left, you can see a headline from ABC News, why Americans voted to protect abortion rights during 2022 midterm elections. And then on the right, you can see a graph that depicts state-level protective measures that were passed in 2023 and the very steep level of activity after the Dobbs decision was made. Next slide. And this high level of civic engagement has continued. So we already talked about what happened in the 2022 midterm elections, but in the upcoming election, there are 10 states that have current ballot measures. And of voters who say abortion is their most important issue in the 2024 vote, this is a KFF health tracking poll that was done March in 2024. These people are disproportionately Black, Democrats, women, and in the youngest voting bloc, they're 18 to 29 years old. Okay, so next slide. Oh, here we go. Why did that happen? Young voters. Oh, okay, so sorry, we're good. So this is a map. Let me just get back to where I was. Okay, so I'm not making any claims to be an expert on all the different ballot measures or the state laws or anything like that. And this map might as well be your test in US geography, but I will help everybody through this. On the top left, moving to the right, we have states like Nevada, Arizona, Montana, Colorado, South Dakota. Nebraska's in yellow because they have opposing ballot measures. And then Missouri. And then on the East Coast, we have New York, Maryland, and Florida. So this proves intense citizen activity and engagement on the issue of abortion or reproductive health rights. And that's because ballot measures are citizen-led, and it takes a lot of mobilization to get something on the ballot. So people are quite serious about this issue. Okay, next slide. And this, when I was talking about the voting blocks, you can see 34% of the 18 to 29-year-olds in this Tufts University survey said that abortion was the leading issue for them. But I want to point out that in general, abortion resonates with the entire reproductive age population. That's the green bar. And when we say reproductive age, we're talking about less than 50. So we got 18 to 50-year-olds. Next slide. So this term, reproductive justice, where did it come from? The origin of the term reproductive justice is from a group called Sister Song that was actually based out of Chicago. Next slide. And here's the origin of the term reproductive justice. The women of African descent for reproductive justice in Chicago coined this definition in June of 1994. because they recognize that the current reproductive rights movement, led by middle-class white women, had not been inclusive of minority, low-income, and other marginalized women. So this group of African-American women started the movement of reproductive justice. This is the group that health inequity, gender-based violence, higher death, and disability. So next slide. So what exactly does reproductive justice mean? So reproductive justice is defined as the complete physical, mental, spiritual, political, social, and economic well-being of women and girls based on the full achievement and protection of women's human rights. So reproductive justice goes beyond the pro-choice, pro-life debate and has three primary principles. One, it is the right to not have a child, but two, it's the right to have a child. And three, it's the right to parent a child in a safe and healthy environment. It also includes sexual autonomy and gender freedom for every human being. So as you can see here, I've bolded 2 and 3, and that's why you have an OBGYN and a pediatrician here today. So as much as the debate on reproductive justice has centered on not having a child, reproductive justice includes and emphasizes the affirmative right for those who do have children. But if this is so, then the next 2 maps are going to show how we as a society or the United States currently meet these principles. So next slide. Okay, so here's state abortion policies in effect as of December of 2023. And you'll see that I've placed circles on the geographic areas to help you focus on the warm colors, because the warm colors, the reds and oranges and yellows, are where abortion policies are most restricted. Now, on the next slide, when we talk about children, here are the percentage of children without health insurance based on a 2021 map. On this map, we see a representation of how our society prioritizes the health of children if we're going to use children without health insurance as kind of the measure. So for purposes of this talk, we're going to focus on the dark blues now, dark blues, and the areas I've circled. But if you were to flip back and forth between the 2 maps, they almost overlap. So there we are today as far as a reproductive justice problem. Next slide. Since this was a League of Women Voters event, I wanted to just share a little bit on the Impact on Issues document that was published in 2022-2024. And I've pulled some of the position statements of our league on natural resources, environmental protection, pollution control. We do have a statement on maximum protection of the public health, and then we can proceed through what our league has said about social policy and kind of basic level of quality care. Basic level of quality care, the purple box, does include prenatal and reproductive health. And then if we go to the yellow box and we talk about basic human needs, it includes access to care, and that includes preventive care, primary care, very importantly, maternal and child health care, and emergency care, and quality child care. So next slide. I think we jumped a slide. Did we jump one slide?
There we go.
Yes. So just getting back to, why language matters, better terminology. Much like terminology change from gun control to ending gun violence, it's the same way. We can use the words reproductive justice because it's broader. It's more inclusive. It's a more inclusive outlook on reproduction that includes access to care, equitable care, the right to not have children, the right to get pregnant, the right to have children, the right to raise children, and the right that those children can grow up healthy and not sick. And next slide. Now here, the next 2 slides are going to be the Venn diagrams that I talked about that are not referenced because this is just kind of something that I was thinking of. So if we return to, again, the civic engagement and the idea of a motivation to vote, this Venn diagram shows that people vote for various issues important to them. And I initially had thought of this as, oh, you know, there's a lot of issues that are important to a lot of people, and there's some overlap, and the arrow is showing the little nexus where kind of all our efforts mattered. But then the more I thought about it, next slide, I think this is a better diagram or a better depiction of climate and environmental justice encompassing health and therefore reproductive health. And the reason is you cannot have one. You can't have any health without the other, which is a healthy climate and environment. And so the premise is if people will vote for reproductive rights, if they understand the relationship between the 2 issues, they must also vote for pro-climate and pro-environmental issues. And this is important because the changed environment is actually harming us and killing some of us. So this is where we need to kind of come out swinging. So now we're going to move, if you know, as I said, how are we going to proceed? We're going to move into the discussion of how this affects our health. And I thought the most effective way to do that would just be to share some of my patient stories. So as far as heat, like how do you know how heat affects pregnant people? I had a 30-year-old, healthy, married, college educated. This person was actually in healthcare, was a mid-level practitioner. First pregnancy, in the 8th month, completely uncomplicated pregnancy, been to the hospital before, and presented to labor and delivery with complaints of contractions. Well, 8th month is way too early. So the history was significant for gardening in 90+ degree weather, which is really not that uncommon. The patient had complained of false contractions in the past, but interestingly, had been restarted on an antidepressant about 6 weeks ago. So I'll just tell you about the admission. So it was a 3-day admission to the hospital, in hospital on the acute care floor, involving lots of monitoring, lots of lab tests, many exams, a bunch of consultations, and a lot of counseling. But the good news is that the patient was we were able to send the patient home still pregnant. But my question is how does an experience like this impact this person's pregnancy? I mean, we all, some of us have gone through pregnancy, some of us have children, but what kind of fear, what kind of anxiety, what kind of worry surrounds an admission like this? And when I talked about the antidepressant being started, that's significant. Not only are pregnant people more vulnerable to heat, there's also a lot of people in general, but in the pregnancy population that have mental health diagnoses. So this patient had that diagnosis. And there are certain medications like the one that this patient was on that will increase the risk of heat illness. So that's one story. And as far as extreme weather, I have 2 really short stories. When Hurricane Florence kind of hit the Carolinas back in 2000, I can't remember the exact date, but was in the 3rd trimester and had heeded the warnings. And the only way that they could get to family in the Midwest was to take a road trip to Arlington Heights. I don't even think the family members were in Arlington Heights, but just the road trips. And, you know, we don't really suggest road trips. I mean, for long trips, especially in the 3rd trimester, but presented to labor and delivery, again, with contractions because of having to leave because of a storm. And then the other extreme weather event was Hurricane Maria in 2019 and how that impacted labor and delivery. This is what, when you hear about supply chain problems, this is the supply chain problem that happened. So IV fluids are very, very important to our work on labor and delivery because, one, they protect the pregnant person during labor and delivery from hemorrhage. They can help with the fetal heart rate, resuscitation of the mom and the baby during labor and delivery. Anesthesia needs good IV fluids. It's the best way to deliver some pain relief. It's the best way to deliver life-saving medicines. Well, after Hurricane Maria, we had a shortage of IV fluids. I mean, it was unbelievable. And the last thing, and this is not a story, but pollution. And Barb, if you just hit we'll have some things kind of float in. And you can, yeah. So I'm sure people on the call know, but you know, the interaction of heat and pollution, the heat makes pollution worse, but there's more evidence in the literature now, if you've heard of preeclampsia, that there are potential mechanisms with air pollution and increasing the risk of preeclampsia. And of course, California has provided a lot of examples for how wildfire smoke exposure during pregnancy has increased the risk of preterm birth. And that's not just in California, that's just the reference that I pulled up. And then the natural experiments, that's the next slide in case you just want to hear about natural experiments. So there were studies that came out after there were retirements of oil and coal power plants in California. And what they saw after the retirement, that there was a clinically significant drop in the outcomes of pregnancies. They call it a knockout test or a natural experiment, but there was actually a 27% reduction in preterm delivery. We have never been able to achieve that with any other treatment or therapy. So that's what they call the natural experiments or knockout tests. And then my last slide is just kind of a summary of some highlights of the climate-related health impacts on women and female health. So we have female physiology that might put us more at risk for greater death during heat wave events. We know that there's an unequal distribution of resources amongst our population. I already told you pregnancy is high risk. Air pollution itself, when they've done the studies for air pollution and heat, how it affects the pregnant population, they are at high risk. Pregnant people are at high risk for stillborn, low birth weight, and preterm delivery. But when they looked at the data, that threat was most pronounced in asthmatics and African American pregnant people. Of course, the extreme weather events, there's higher injury rates, higher gender violence, higher incidence of mental health disease. And then if we want to talk about vector-borne disease, pregnancy increases susceptibility due to our physiologic and hormonal changes. So that is my portion of the presentation. I'm going to turn it over to Dr. Sullivan.
Before you do that, if it's okay, I will read off Dr. Sullivan's bio. And thank you so much, Dr. Gomez. That was fascinating. There was just one question in the chat that we can probably address after Dr. Sullivan speaks. So Myrtis Sullivan is a board-certified pediatrician. She currently holds the faculty appointment of Professor of Pediatrics at the Chicago Medical School of Rosalind Franklin University. Dr. Sullivan has been an independent consultant for Medicaid and Medicare managed care organizations for over a decade. Her past professional experiences include the following: medical director at Healthcare Services for Blue Cross Blue Shield, State of Illinois Title V Maternal and Child Health Director, medical director of Pediatric Emergency Services at Cook County Hospital, attending physician, Great Lakes Children's Environmental Health Center, and faculty member at the University of Illinois at Chicago School of Public Health. Other academic and service-related leadership positions include chair of the board of directors of the Illinois Child Healthcare Foundation, member of the board of the Illinois Clinicians for Climate Action, former president of the Cook County Physicians Association, which is a local chapter of the National Medical Association, and former chair of the pediatrics section of the National Medical Association. Dr. Sullivan's research experience and interest include maternal and child health policy, elimination of maternal and infant mortality, climate change and pediatric environmental health, bronchial asthma, and community-based participatory research. So now I'd like to introduce you to Dr. Sullivan.
Thanks so much for that wonderful introduction. It's a pleasure to be here with the League of Women Voters and to share this important information with you. So we can begin our slides. I will continue on where Dr. Gomez left off. Oh, the slides look a little different.
Oh, there you go.
Okay. I will continue where Dr. Gomez left off because the mother-infant dyad is so intricately, connected that what happens during in utero definitely can affect the infant throughout that infant's lifetime. So it's important that we really learn a little bit about what can happen because of intrauterine exposures. And as was mentioned before, reproductive justice, the definition certainly includes the right to take care of your children in a healthy and safe community. And that's what I will focus on with this part of the lecture. And again, catastrophic effects of climate change on children's health begins in utero, really preconceptually, because what happens to the mom preconceptually can also affect the child throughout his or her lifespan. And so, but they definitely start before birth if there are exposures. And this slide just depicts, from the pregnancy stage through infancy, childhood, and adulthood. So one single exposure can affect that infant, that embryo and infant throughout the lifespan. So it can be an important, huge burden on the health of that individual. Next slide, please. Again, these adverse effects can start before the child was born. And there are a myriad of adverse effects that can happen due to toxic exposures. Some of those include autism spectrum disorder that has been increasing over the years. And we don't really know why, but there are some hypotheses that exposures and climate change can affect the growing fetus and infant. There are other developmental disorders, cognitive defects, congenital heart disease, a host of allergic disorders, including asthma, hay fever, or allergic rhinitis, certain cancers, certain mental health disorders, as was mentioned before, and then other diseases, cardiovascular, metabolic problems. Next slide, please. As was mentioned, communities of color are often disproportionately affected and carry the biggest burden of health effects that climate change can cause. And while there are other communities and populations that are at risk, such as the elderly and people living in lower income communities, because a lot of the coal-firing plants and other plants that spew out toxic gases are often situated in low income communities. And then also we mentioned children, who I will focus on with this talk. Next slide, please. Oh. And why are children at a higher risk? Mainly because of their physiology. And compared to adults, children breathe more air and drink more fluid for their body weight. They're shorter and they spend more time on the ground, and that means that they're closer to these ground level pollutants. They engage in developmental behaviors that increase their exposure, like eating with their hands, picking up things, crawling on the ground and picking up whatever is there. And so these behaviors make them more vulnerable to air, water, and soil exposures. Next slide. There are other behavioral and biological and developmental differences that make children more at risk and more vulnerable to exposures. They have immature immune systems, and therefore they're more sensitive to exposures that can cause permanent disabilities throughout their lifetimes. They're dependent on caregivers, and they may not be able to respond appropriately to threats, toxic threats. They're at risk for injury and even death in extreme weather emergencies. We often hear about children being left in a car seat, and a number of them can die because of the extreme heat. And this has been increasing because of global warming. Children and adolescents engage in more outdoor activities, so therefore they're outdoors more often and get more exposure to heat and outdoor pollutants like ozone, and then also exposure to fine particulate matter and aero allergens. And that's why they present to the ER with asthma attacks more frequently now. We'll talk about a little bit about that later. And I certainly am really familiar with this. I was the director of the pediatric emergency department at Cook County Hospital for a number of years, and that was our number one diagnosis. And in the summer months where there's intense heat, like in 1995 when we had that extreme heat wave in Chicago, we had a huge increase in numbers of children that presented to the emergency department. Next slide. Other adverse effects: children under 5 in general just bear as much as 88% of the global burden of disease from climate change. We talked about some of the outdoor exposures, air pollution, extreme events. Dr. Gomez mentioned those. Heat waves, hurricanes that we saw, like Hurricane Helene that just happened in the Southeast. Severe storms are increasing. Dr. Gomez mentioned wildfires, floods, and droughts. All of these put children at risk. And then these wildfires are happening more frequently, and they're more severe because of global warming. It's the same is for the heat waves in general, and they exacerbate and worsen chronic conditions. And not only does it affect health because of the outdoor exposures, but because these wildfires really can cause families to become homeless, lose their homes, and then also children fall behind in school because they can't attend school because of they have to relocate. So, and as Dr. Gomez mentioned, the vector-borne disease can increase too because of global warming. Next slide. Again, we mentioned the heat waves and that asthma is worsening because of climate change, the air exposure to air pollution, and then the heat from global warming causes more pollen growth and more pollen production, and therefore children are more exposed to more pollen because of this increase due to global warming. Next slide. So I'll talk a little bit of make it a little closer to home. We constantly are seeing more cases of heat stroke among children and adolescents because of increasing temperatures. And this one particular study that was posted in the American Public Health Association's website and also was on the news involved a junior high athlete. It was early August, and we'll call this student Logan, who attended junior high school basketball practice. The intensity of the drills was matched only by the temperature of over 100 degrees inside the unair-conditioned gym. And in lower income communities, often air conditioning is a problem. But in Chicago, the public school system made it a priority and a mandate that all schools are air conditioned. And that is, a welcome change because of global warming. As the practice progressed, Logan became dizzy and eventually collapsed. He suffered heat stroke and developed life-threatening complications. And after a week in the hospital, Logan returned home. But unfortunately, he returned home and he was better. But unfortunately, heat stroke is becoming more common, and some athletes are not as fortunate as Logan, and some of them have succumbed to death and disability because of the extreme heat exposure. In fact, between 2018 and 2022, at least 11 football players in the US at the student and professional level have died of heat stroke. And the number of young athletes diagnosed with exertional heat illness has been increasing over the past decade. And it is unprecedented. And as this unprecedented extreme heat butts up against football season. So that was documented by Singh in 2023. Last summer was the hottest summer on record in North America. So we are seeing increasing in heat and temperatures and therefore more impact on the health of children and adolescents. And football players are often also subjected to the synthetic turf. And this can exacerbate the heat problem because synthetic turf can get up to 60 degrees hotter than natural grass and radiating temperatures above 160 degrees Fahrenheit on summer days. So that's something that we have to be cognizant of as well. Okay, next slide, please. This is a case, I thought this was quite interesting. That's why I'm including it here. Held versus the state of Montana, where a group of students took action and political, legal action, in fact. And it involves 16 Montana youth ages 5 to 22 who took legal action to safeguard their rights to a healthy environment, life, dignity, and freedom. The youth were represented by attorneys with a nonprofit U.S. law firm. The court ruled on the merits of the case and the government violated the constitutional rights of these children through laws and actions that promote fossil fuels, they ignore climate change, and disproportionately imperil young people. And Julia also was the chief legal counsel, and this was a quote taken directly from her. The decision to span more than 100 pages, and it articulated critical findings regarding the rights of youth to a safe climate. Some key points included recognizing that additional emissions of greenhouse gases worsen climate impacts, the dangers of irreversible climate injuries from continual gas emissions, and the necessity of science-based measures to combat climate change. So it's putting the onus of the government. And we're going to see more and more of these losses as if climate change is not abated drastically over the next ensuing years. Next slide, please. And again, want to underscore the effect of wildfires, in that these wildfires not only affect the region that they occur in, or the cities they occur in, they can travel. Because you remember last year, those Canadian fires, we could smell those and see it in Chicago, as far down as Chicago. And certainly this Journal of American Medical Association article that was published in 2023 found a stark association between Canadian wildfire smoke and the increasing numbers of people being seen for asthma-related symptoms in New York City emergency departments. The same was in the Canadian wildfires and California wildfires. In fact, the Canadian wildfires even traveled down to Washington, D.C., and as I mentioned, to states in the Midwest. Next slide, please. So what do we do? Again, it's so important to vote. This is huge, important election year, not just in the US, but across the globe. This year, elections will affect the lives of approximately 4 billion people across the globe. So as voters, we must urge politicians to protect our children's future. The goal that has been set by the Paris Agreement is to limit global warming to 1.5 degrees centigrade and net zero emissions within the next 25 years, or we will be facing irreversible changes in our climate. And if we continue to lag behind and don't act quickly enough to abate climate change and global warming. And remember, climate change not only just affects our health, but it can also affect our access to voting. You see what happened in the Southeast, some of those communities are totally isolated because of the flooding. And so this could still happen. And so we have to be very careful and that ensure that everybody can vote safely and cast their vote, and that they have their vote counted regardless of the weather. That's something that we have to be mindful of, to tell our fellow citizens in our neighborhoods, our local politicians, that to look at the weather forecast so that we can plan accordingly. We must cast our votes wisely and safely. So thank you for your attention.
Thank you so much, Dr. Sullivan, and thank you so much, Dr. Gomez. So we will open the floor to any questions. One of the only question we have right now in the chat is to define preterm birth. That was directed at Dr. Gomez.
Yeah, so preterm birth is anything less than, we use weeks, not months in OBGYN. So it's anything less than 37 weeks. And the problems with preterm birth are obviously, big ones are like lung immaturity, other organ immaturity. But the big one is not being able to breathe.
So opening up the floor to any questions or comments we might have. You can put it in the chat. I'm guessing you can also raise your hand because we don't have that many people on. If you raise your hand, we can call on you.
I think we didn't really want to go into too much of the nitty gritty on health things, because that's kind of another talk, but I'm sure Dr. Sullivan and I are happy to answer and clarify anything in case something came up or you have a specific concern.
I'll jump in a second. Thank you so much for what you've been describing. They are the practitioners, and they see firsthand what has been happening, especially U of I. So at the office I work, which is EPA office, I've been working on climate change issues for 35 years now. And one of the great things that has been happening is what Regina and Dr. Sullivan are doing, which is trying to incorporate the environmental research that our scientists are coming up with into the actual medical curriculum. And I know EPA has given grant money to where you used to work, Dr. Sullivan, at UIUC, and there used to be a environmental, I don't know if it's still there, but we gave grant money for a pediatric environmental office. And there were various offices like that. That was the first time, I believe, in the country. That was very innovative, never happened before. And so we would get calls from the public about concerns about their babies and their children, and they thought it might be environmentally related, and we would refer them to your office, UIUC. And
yes, it's still there. It's still
is
there.
It still there?
Yeah, Dr. Susan Buchanan.
Susan is still there. Yeah, I worked with Susan years ago. Yeah.
Yeah, the Pediatric Environmental Health Specialty Unit. I started, when it was first started, I was the pediatrician that was assigned to that specialty unit.
That's excellent. So we have a question. Do you find that your patients and families understand the effects of climate change?
They know something that's happening, especially the families with children with asthmatics. They have seen the heat really affecting children, and that the summers are getting hotter and hotter, and the air is becoming more and more polluted. And so they don't really verbalize, oh, this is climate change and that's what's happening, but they notice there are both indoor and outdoor environmental exposures that are exacerbating the asthma that the children have. So yes, they see the effects, even though they may not know the terminology to use.
Mm-hmm. Yeah, I would agree that when we do consultations with patients, and if we can make the connection for the patients and give, we call it anticipatory guidance to our patients, much like you would ask a patient of all risk factors. But then when we know that it's been hot outside, or there was a bad air quality event, and we know how that's related to the reason they came in, and we bring that up. I mean, those are, I think for some people, those are opportunities to understand better how environment affects health. I had this one, I was at the Benjamin Moore store buying paint, and I could not help notice that the customers to the right of me were like, she was super pregnant. She was she looked like she was about to deliver, and they were picking up paint for the nursery. And as far as the volatile organic compounds, I mean, we have different kinds of paints now, and some are, I mean, they're not zero, but they're called zero. And I made, I kind of just kind of approached that person. And I said, if you're going to choose, something for your nursery, that over there is good. And I told her as an OBGYN, and, she was like, oh, we didn't know that, so just education and pointing things out, I think. So I do think if we are good at communicating that information, patients and families will definitely understand it. And then I was going to say, like, as we've been advocating, especially in communities where, like Waukegan, North Chicago, I think the people who have experienced the health effects, some of the biggest advocates are the people who have seen it happen to themselves or their family members, and they know that the Superfund sites, they know that the things that are emitting things into the air are wrecking their health and their family's health. And so maybe they don't know all the the physiology and the scientific terminology, but they sure can attest to what's been happening to them, and they're absolutely right.
And all the asthmatics, we give an asthma action plan. So, and it's a form of participatory guidance that they have to know all of their triggers. And then, of course, what to do when the weather is really hot or there's a high pollen count. All of these triggers have to be, the patients have to be educated about and know how to avoid them, to avoid the triggers.
Yeah, and one of the niches I think that the league can do is that there's a lot of information that's been developed that we can probably help to give out. For example, none of us can single-handedly stop the environmental consequences of climate change. And in the field, what we consider climate change is an exacerbator of all the stressors that are already happening. So the toxics, for example, in the Great Lakes, toxics that we get into our food and our body, it's all exacerbated by climate change because the chemicals get more concentrated as it gets hotter, and the water absorbs more. So, for example, the Biden administration has opened an office of environmental justice for the first time. And I myself am involved. I'm the regional climate change contact, and we're doing a lot of grants, and we give a lot of money to Indigenous folks. And some of these grants are trying to get out what you guys are talking about. But there is a ready-made list of things we've come up with over the years where you can reduce your ambient exposure to a lot of the substances that are being exacerbated by climate change. So we can do that. So, for example, things you wouldn't think about. 25 years ago when I was pregnant, I knew not to go into the dental offices because they still used amalgam, which is mercury, and it was in the air, because we would go in and bring our magnetometer and measure the mercury in the air. That I tried to get that out to as many doctor offices and hospitals as I could, but that wasn't something that was out on a public policy level. And you guys are actually the conduit to getting all that information that we already have out to that. And the League of Women Voters has come up with, I think, a list, and we can come up with a better list based on what you guys are talking about tonight. And one of the questions that came up was with regard to the fossil fuel plants closing. Now, the fossil fuel plants emit some of the worst pollutants ever, dioxins, which is one of the most toxic substances known to mankind, and mercury. Mercury is a neurotoxin. So the closure of these fossil fuel plants has seen a reduction in some of the neurotoxic illnesses that we've seen. So there is a direct correlation with that, and that was the question. The TVA, Southern Company, Duke Energy have been closing a large number of fossil fuels. Has anyone looked at the preterm births in the Southeast? There's a lot of work being done by a lot of the federal agencies on that, Joyce. The CDC probably has that. Maybe the EPA office down there has it. But it's known because fossil fuels plants are some of the worst polluting entities on the planet. And the good news is that they're shutting down, and there's a lot of reduction in mercury. So we should see a concordant reduction in neurotoxin-related injuries, I would say, over the next 10, 20 years. But maybe Dr. Sullivan and Dr. Gomez have more information on this specific region.
I just was gonna make a comment just from a clinician and kind of how research happens. You know, it takes a lot of effort to get things published. And then it takes, I think, like when something new comes out, and again, it's already going to be old, right? Because a lot of this is like retrospective. It then takes another 20 years, I mean, to communicate this information. So we're always kind of behind. When I looked at the question, the first thing that came up for me was the information that was published by the medical societies in Pennsylvania about fracking, and they had done great studies as far as like distance from the fracking sites, and they could definitely see the closer in the pregnant people were, the worse the outcomes were. So I think you know, there's a lot of local medical societies that tried to analyze the data, but this is the same kind of, I think, problem we have, just like in the profession of medicine, is we're all looking for data, like, you know, this direct kind of, a lot of people need direct A causes B, but sometimes, you know, you can't have that, and you can't do some randomized control trial, and you know, there's preventative measures that you can take so that you don't actually have these natural experiments. I don't have any specific knowledge of the Tennessee Valley Authority. I don't know, Myrtis.
Not of that, but certainly you can look at the CDC and data that are available, and you know, that if those numbers are available, we could really look it up, but I don't know any offhand. The only thing is, as Regina mentioned, that we know that there's enough published data right now that exposure to pollutants and particulate matter during pregnancy, that definitely causes preterm delivery and low birth weight. And premature infants and low birth weight infants. So,
and I'm a practical person. There's enough information that we have, right?
We can act on. It's enough published information that we use the term, the cautionary rule.
Precautionary principle.
The cautionary principle, because it's enough information. We can't wait. We don't have the luxury of waiting, as Dr. Gomez mentioned, 10 years from now, 5 years. It's enough evidence to act now.
Barb wanted to know, how did you hear about our program? Not sure who that's directed to, Barb. Barb, are you still here?
I think she was just trying to get an idea of how everybody learned about the
event. Oh, got it. Okay. Yeah, so we'd love to hear how folks have heard about this, and if you have any other suggestions for follow-up. Maybe what we can do, if it would be helpful for folks, is building on what Dr. Gomez and Dr. Sullivan have talked about tonight. We can put out some ways of reducing your risk to the effects of climate change. And there are ways. We always make a plug for the best thing you can do right now is plant trees, plant trees, plant trees. That has so many benefits of capturing carbon, increasing the ecosystem resilience, clearing the air around you. So that's like the low-hanging fruit, believe it or not. But we can certainly follow up.
I did want to respond to that one question from Joyce that's in the chat. Only because, you know, for where we are, Dr. Sullivan and I are faculty in North Chicago. And so this particular issue is huge in that community. And